Hey, well, welcome everybody to our Canadian Alliance BNL Coordinated Access webinar series. Today we're going to be talking a little bit about busting barriers, and it's always an interesting topic. People have challenges and struggles that they deal with, and so it'll be a great opportunity to hear what some of the key barriers are and maybe how they've been addressed. So before we move forward, it's important that we think about and talk about where we work, live, and play. And I would just like to actually read this land acknowledgement, something that we like to do to kind of provide a pan-Canadian perspective on this, but hopefully it suffices for people who are on the call. From coast to coast to coast, we acknowledge the ancestral territory of all of the Inuit, Métis, and First Nations people that call this land home. We recognize the historic and ongoing impacts of colonization and are committed to decolonization of our systems and ongoing reconciliation, guided in our work by the United Nations Declaration on the Rights of Indigenous Peoples, the TRC Call to Action, the Missing and Murdered Indigenous Women and Girls Calls to Justice, and the Principles of Empowerment and Self-Determination. The Canadian Alliance to End Homelessness is committed to equity, dignity, justice, and belonging, and we are dedicated to serving equity-seeking communities as anti-racist, anti-oppressive, and inclusive allies. So thank you for listening to that. It's an important piece to the work that we do. So I'm just going to introduce myself quickly. Wally Check, I'm the Director of Training and Technical Assistance with the Canadian Alliance, and I'm here as sort of your host and facilitator. And I have one key guest here, Kelly Gauze, Program Coordinator at Windsor, and I chose this picture because she's in action. I wanted you to see her in action, and she's often in action. So we're grateful to have her here. And I know that I may have one other individual who is coming in that might be able to talk about some of the things we're discussing today too. So if they are able to be here and I see them, we'll touch base with them also. Just quickly, the Canadian Alliance to End Homelessness has become a fairly diverse and broad organization. These are kind of the key components of what we do. You're familiar with many of them, if not all of them, but you can go to the website at cah.ca and you can click on any one of these links to get more information about what they are. So feel free to do that, and we'd be happy to have any of your comments and feedback as well. Our mission is that the CAH leads a national movement of individuals, organizations, and communities working together to end homelessness in Canada, which is why we do these kinds of webinars and community of practice calls, is to help us all work together. And we need to mention that we are in part funded by the Government of Canada through the Community and Capacity and Innovation Funding Stream of Reaching Home. And so we're grateful for their input of resources and their leadership and direction in the work that we're doing. So the webinar process is essentially, we're going to be a max of an hour today. The idea of a webinar is to really provide information and ideas. And if there is time, then we'll have some question and answer opportunities or some open discussion opportunities. And we record all of these, and the recordings are available on our website, the TTA website, in our webinar archive section. So you'll be able to see the recording as well as a PDF of any of the slides that we have here. Please remember, I think you're automatically on mute, but please remember to stay on mute until we sort of unmute you to be able to talk. So just in case you get off mute, just to avoid background noise and things like that. Try to use the Q&A feature for questions you might have. It's easier for us to keep track of them and log them, but if you do put them in the chat, we'll work to monitor that as well. And the agenda for today is very simple. I'm going to provide a brief intro to the topic, and then I'm going to direct some questions to Kelly and let her talk about some of the things that she's prepared in her mind today that would be helpful for you people. And then if there is time, we'll have some open conversation, and then I'll have some closing comments. I'll share a slide with you that will give you some updates on upcoming webinars and so forth. So if that all works for everybody, then we'll get going. If it doesn't work, I'm sorry, too bad. We're going to get going anyway. And that's just the way that it is. So we're talking about busting barriers in our by name list and coordinated access implementation. And as I mentioned, I mean, I know that we all have barriers. Every community has barriers and struggles. And, but there's been several that kind of continue to crop up that we see. And so I wanted to talk just about a few of those. They may or may not be the same ones that Kelly will talk to you about, but just to highlight some of the things that we see as barriers that makes it difficult for this process to be implemented as cleanly, successfully as it might be able to be. One of those that comes up often is the lack of a champion in the system, or a consistent champion. That sometimes it's difficult to have someone who can continue to rally the troops and raise the flags of the work that we're doing, and have it be people that are trusted and that are responsive and that people respond to. So this is a common one that we hear about. Another one is community buy-in as well as community partner buy-in. So we have different organizations within our systems that are we hope can be involved in this process, some that have to be involved in this process. And sometimes we struggle because some of those partners don't necessarily buy into the process or completely understand it. Another one that comes up oftentimes is issues around privacy and information sharing. And that tends to create some walls at different times as we struggle to ensure that we can share the information that we need to on a timely basis. We also run into barriers related to cultural and subpopulation nuances, where, like, for example, we know that there are challenges that many Indigenous organizations and communities have with by name lists and coordinated access process in general. And it's important that we take into account all of those concerns that people have and work to build those into our system. And so when we have, a system that has high numbers of people from different subpopulations that have these concerns, it means a lot of work and effort to make sure that we can do things that allow people to feel good about the process that's been created. So that's another popular one. Also, it kind of related to buy-in is this lack of understanding. I think that's in part one of the reasons that buy-in is a barrier, is there is a level of ignorance and a lack of understanding within the community about what this really means. And so I think we have to think about, well, why is that? What's caused this lack of understanding, and how do we address that? And then there's this forever ongoing lack of community tolerance. You might call it NIMBY, you might call it lots of things, but we're dealing with people who other people in our community have a difficult time with, and the level of tolerance is such that lack of understanding comes into play, and it makes it very difficult for people to understand why this kind of process is so important. And then I think the one that I will end with that seems to be a real big challenge recently is this lack of resources. I hear lots of communities talk about how difficult it is to move forward or to even think about developing a coordinated system when they feel like they have no housing. So there's no reward or pot of gold, so to speak, at the end of the rainbow. So we bring people into this system. What are we giving them? And so there's a sense that if we have this lack of resources, like in particular housing resources, that creating this system is almost a waste of time. And so people struggle with that, and it prevents people from being able to move forward. So with that, I'm going to just ask you a question, Kelly, if I can. Like, what are your thoughts about sort of those barriers and just barriers in general? What has it been like for you and your community to address barriers that come up?
I think for us, we've always had to look at it not from a deficit position, because we can always find something that isn't enough or isn't there or what we perceive to be there. And really start from a very honest conversation with the community and with different levels within community organizations. So whether it's persons with lived experience, frontline staff, middle and management, and senior management, to change the conversation from a municipality standpoint of what's not missing, but what the opportunities could be if we continue to look at this as from like a solution oriented perspective, because there will always be something that's missing in trying to create by names list or coordinated access systems. But what do we have in our community that's working well for us? We have relationships. We can build off of housing first programs. I think with regards to housing availability, once we start to understand the data that comes through on our by names list, we actually are going to start to see that there are housing resources, and how do folks that are experiencing poverty or that are most marginalized in our community are able to access housing, and how can we capitalize on that from an understanding perspective to find out what is working well and how people are able to self-resolve their own instance of homelessness. And they've historically been able to resolve their own instance of homelessness. And how can we iterate that and grow that knowledge from people that have experienced homelessness and have experienced sometimes generational poverty, and work within our organizations to grow that housing base and that resource base. And additionally, like when we look at system champions and trying to get buy-in from community agencies, who are those folks in the community that naturally are looked to and who are able to bring different perspectives, who are able to challenge the status quo, who are able to push you in government or within the municipality or the end homelessness organizations, to ask different and to ask those hard questions to make you think differently as you're putting these policies together. Anything, I believe, in what we've seen we've been able to put good processes in place by having those really difficult conversations and not coming into this work with already a preconceived notion of how it's going to operate once it's operationalized, because you will quickly find out you need to be nimble. You need to be able to adjust on a moment. Things are going to happen. You're going to have investments one year and no investments the next year to be able to put towards this. But how committed can the community be together to continue to look at this and grow and continue to build a system that is keeping the person at the center, so that we are able to talk about not, we've got 495 people on our by names list, but what is working well for John and Sally, and maybe what's more importantly not working well for them. Why is their homelessness going into this long-term chronic homelessness? Why are their acuity levels continuing to increase? As a system, what is broken, and what do we need to do together to start address those things that maybe have not worked well historically, but nobody wanted to talk about it because it's just the elephant in the room.
I really appreciated when you said earlier about how the development of the system will actually help us to see more clearly that maybe there are more resources available than we thought. And there's a lot of communities that really struggle with that, because if they can't see them right in front of their face right now, they often feel like they're never going to exist, right? And so I think that's a really important point, that the system sort of kind of clears the fuzziness sometimes and helps us to see those things. I have another question for you. What would you say to a community who says, well, we don't really have a point to developing a coordinated access system because we're already coordinated?
I think that's interesting. And I think the data is really start to help you understand where you are coordinated and maybe where you're not coordinated. Again, the data that comes through on a by names list is very transparent. And where you think you may have wins, you may also be able to find out where there aren't. And again, talking about specific files or specific people on the by names list who start to languish on the list, and maybe may not be able to be supported in housing or have high returns from housing to homelessness. And you start to see those cycles of recidivism. You start to see where your inflows are coming from. Are they coming from jail? Are they coming from the healthcare system? Are they participating in a very meaningful way around ending homelessness? Those are the gaps that start to come quicker than I would have expected to see them. And again, starting to help those other sectors understand the language around what constitutes homelessness and what constitutes discharge into housing. So for us locally in Windsor, the hospital for the longest time said that they didn't discharge into homelessness because they discharged to shelter. As we started to unpack the language, we helped them to understand that, yes, although you've discharged somebody somewhere, a shelter is not housing. A shelter does not allow for in-community healthcare to be following that individual because the wound care nurse is unable to go into shelter, or that individual is unable to get home and community care to come out to do long-term IV treatments because that environment is not sterile, or that person has to leave shelter in the morning pre-COVID. And then where do they go with their IV bag for the 12 hours of the day until they can access shelter again? So I would challenge the communities that are saying we are very coordinated. We work really, really well as a system within homelessness, but how does that extend to other sectors like housing, like health, like justice, and where can things improve so that we're ending all homelessness and that it's not one sector that's been tasked to do this work, because we cannot in the homelessness sector end all instances of homelessness on our own. There are other partners and other stakeholders that need to come with a significant number of resources that the homelessness sector is not privy, does not have access to.
Yeah, great points. Thank you for that. So with the last 2 or 3 minutes that you have left, are there some specific barriers that kind of stand out for you from the work in Windsor that you think might be helpful for people to hear a little bit about in terms of how you address them?
I think talking about privacy and shared consent first and foremost about how you're going to orient that and what does that mean is super important, and also consider other sectors and where you want to go as a system longer term. What we found is that people were great about adding or referring folks to the by names list or to our coordinated access system. However, didn't understand more so the importance of keeping somebody active on the by names list. And we've had to do a lot of work over the last 2 to 3 years around creating things like inactivity trackers and really trying to focus about keeping people on the list, not just getting them referred to the list. And by keeping folks on the list, what were the longer term impacts and benefits to both the participant, but also to the system and to agency staff with regards to the efficiencies that they could find from a time management perspective, of taking that 2 hours to go through that list every month to making sure that that person has a last contact date so they don't flip to inactive. So more, keeping folks on the list was the most important. Also adding other resources like rent subsidies, about other supports and services around case management to the list. And again, looking at it very holistically and not very just singular focused, I think was the biggest thing that we found over the last, 4 years or so of doing this work.
So when you talk about, the need to do that work to keep people active, that's time consuming, right? And so does that mean that you would support the idea that if at all possible, ensuring that you have the right level of sort of staffing resources available to give the time to that is going to be essential? Like, I mean, a lot of people feel like that they can do things off every corner of their desk, right? And I'm just hearing that some of those things are going to mean that, you're probably going to have some dedicated staff.
Absolutely. And it goes back to the champions in each organization that you're working with as to who fully understands this process, and helping them understand that, your organization or your shelter has done a lot of work to support John to get him to this point. However, if nobody continues to let us know that John is still experiencing homelessness, more or less, he's no longer eligible for housing resources. He's no longer eligible for case management supports. We no longer know as a system that John is still experiencing homelessness. And, you're going to continue to have to refer and continue to have to do all of that work every 6 or 7 months when you're looking to find out why hasn't John gotten housing or an offer of housing yet. So being able to distill it to the person and helping agencies understand it from that context, we found to be very, very helpful, as opposed to talking about it at a macro or a very high level of all of the participants on the list. When we can attach the emotion with regards to specific case files that are maybe more challenging, or that shelter or that agency staff is very passionate about, made a world of difference to helping them understand the processes as to what happens when they didn't do certain things.
Yeah, makes total sense. Completely. Well, I know that you've got to run off, and so I don't know, is there any sort of last comment that you would make before you zoom off to your next thing, or just,
I think start small.
Yeah.
Start small with the folks that have buy-in to this, but also start with a few of those critics in the community that that are going to push you and really make you think differently. Include people with lived experience in the journey. They are the experts as to what works well and really what doesn't work well. And be open to the criticism and open to those honest conversations, because that's how we get to a really, really good product at the end. And if we are all working to support folks experiencing homelessness, we have to include them in the conversation, and looking at those cultural considerations around subpopulations is very important. Have Indigenous organizations and youth serving organizations and veteran serving organizations part of the conversation early days, so that they feel like they're informing part of the process, as opposed to you having to completely change the direction, or conversely have them feel like it's more of a checkbox and it's not genuine engagement throughout the process. So just something to think about.
Yeah, great stuff. I often tell people your naysayers can actually end up being your greatest champions, right? Because they look at the passion and energy they have. It may not be where you want it to be right now, but it matters to them for some reason. So yeah, no, great. I really appreciate your time, and I will let everybody know that that Kelly has told me that if there are questions that come up regarding the things that she has said, that I can certainly pass that on to her, and we can follow up later, and she can potentially respond or give us something to respond with based on some of the things that she said. So I just want to thank you again for taking the time today, and good luck in the rest of your meetings that you're off to, and everything else that you're doing. And thanks for your great work.
Thanks, Wally, and good luck to everybody trying to implement this. It'll all work out. Just be brave and just start somewhere. Thanks, Wally.
Kelly, take care.
Bye.
All right. So you've heard some fantastic thoughts from Kelly, and from a system who has done really well, who has um, made great progress in some of the things that they've done. I actually want to, she's not expecting this, but I'm going to surprise her. I know that we have Lisa Bell on the call, and I'm actually going to unmute her and ask her if she would actually just speak, because she's the improvement advisor from Built for Zero who works with Kelly and her team. And I just wanted to get Lisa to maybe comment on some of the things that she's seen in relation to the work that Kelly has talked about. So, Lisa, I thought I unmuted you. There you go.
Can you hear me?
I can.
Yeah. So you're kind of putting me on the spot here, Wally, but that's quite all right. So Kelly was awesome in, sorry, that's my cat. Kelly was awesome in sharing some information about the inactivity tracker. And what barrier that really addressed was having a lack of updates from folks in community. So they put together a really great process for how somebody can be added to the by name list and how they pull the information from all these different providers across the community, and not just, you know, the main homelessness response providers, but those others that only sometimes connect with people experiencing homelessness. But then, you know, every month they'd see a ton of folks move off of the active by name list and go to inactive, and then eventually come back on to the by name list. And so it was really difficult to coordinate access to their housing. And so the inactivity tracker was a great way for them to be able to get a better pulse on making their by name list truly actionable and a tool for coordinated access. And I just think that was a great way to kind of bust through that barrier. And the barrier wasn't only related to getting updates from providers, but more so just provider participation in general, and providers understanding what their role is and can be in the coordinated access process. And so the inactivity tracker served a great function in a process type of way. But it also meant that they strengthened the relationships with the providers, because this was another reason to connect and converse with them, and then get further ideas for how to improve the by name list and using it for coordinated access.
Yeah, thanks. That's actually a great sort of follow-up and explanation, because I don't know that I would have realized that the barrier was about people struggling to report what was going on. So I appreciate that clarification. So Lisa, you know, you've been here and listening to the conversation, and I'm just curious to know what your thoughts are, sort of in general, around the challenges that communities face with different barriers, and what maybe some other barriers are that you have thought of that we could add to that list.
Yeah, I think that was a great list in capturing the common barriers that I see in the communities I'm so fortunate to support. Especially the piece around buy-in and provider participation, as well as there was some stuff on there about resourcing. And so I think Kelly's advice to start small is a great one. You don't want to kind of work yourself into the position where you're constantly doing by name listing coordinated access as a side project. It very much requires the full attention, or at least the partial attention of a staff person on the team. But you could always start small and then kind of see and slowly grow your resources once you have a bit more buy-in to the process. But I do see, you know, that is a common a common barrier in communities is the resource piece, particular to staffing, to kind of get this up and running. And I wonder if other communities on the line have also had a similar barrier.
I would think that some of them do, and I want to actually open it up to them here just shortly. But I want to ask you another question, and since you're on the spot, I'm just going to keep you there. When I mentioned the thing about, you know, and you brought it up again about resources, that again, to recap, a lot of communities feel as though, I mean, every community could probably say this, make this same claim, and that is that we have limited to no housing availability. Right? We hear that all over the place, and you know, communities are dealing with like 0.0 whatever percent vacancy rates and those kinds of things. There's additional challenges now with, you know, landlords that are maybe resistant to working with the types of individuals that we are serving. We have, you know, a lack of affordable units that are available, and if they are affordable, oftentimes they're not livable, and so it's not really an option anyway. So communities have a lot of good reason to say that they have limited and sometimes no housing stock. But what are your thoughts about a community that might say it's impossible or even a moot point for us to coordinate a system that's designed to move people who are experiencing homelessness into housing when we have no housing? How would you respond to that?
Well, first, I'd sympathize and empathize. I think we have a global housing crisis. I don't know of a community, I have yet to hear a community say, oh my gosh, we have so many housing resources, I don't know what to do with myself. And part of the point of coordinated access is to get really good at coordinating and making it as efficient as possible to house people with the resources that are available. And also through a by name list and coordinated access process, what you can glean from that information and experience and data especially is knowing more about where the gaps are. Because it's one thing to say we need more housing in the community, but it's a much more actionable problem to solve if you can say we need more supportive housing units, or we need more intensive case management spots on a caseload, or we need more subsidies. And this is the exact population that it's trying to serve. This is approximately how many people would benefit from this resource. And so going through a by name list and coordinated access process is still incredibly important for advocacy around housing, and also to just improve the current way that you're coordinating as a system around these precious housing resources that are so limited. So if they are, you know, few and far between, how can we make sure that we're using them to their maximum potential? Meaning referring the people who need a particular type of resource the most. We're trying to make informed matches. We're trying to respect client choice in communities and uplift that, as well as advocating for what's missing, what are those gaps, and getting really, really specific with your by name list data of what you need in order to make movement on reductions and ultimately reaching functional zero.
Yeah, thank you. I really appreciate that response. And I think the way that you described it, it was actually very clear and much easier to understand for some people. So I want to now sort of throw it out to the people who are listening, who are on the call. I would imagine that some of you are thinking right now about specific barriers that you are facing that seem to be these insurmountable walls or roadblocks to you moving forward with the implementation of your coordinated access system, or introducing by name lists to your system. You probably have some specific things that are really standing out to you, or maybe some of the things that we've been talking about are resonating for you. And so at this point, I'd like to invite you to actually either raise your hand or put something in the chat or the Q&A to ask a question or to make a comment about any of the things that we've talked about. Because I think, again, part of the benefit of all of this is to create an opportunity for you folks to connect with each other and for us to have a venue to work together and support each other. So I would really love to hear the kinds of things that are on your mind right now. And so while I wait for people to maybe chime in or type something in or let us know that they'd like to talk, I want to just sort of add a little bit more to what Lisa was saying, because I think that one of the challenges that people seem to have a hard time wrapping their head around is this idea that, like I have literally heard people say, well, if we have no housing, coordinating our system more isn't going to give us more housing, because we only have, I literally heard one community say we only have one landlord that we can actually work with. And, they had all of these reasons, and a lot of their frustration was merited. I get it. But one of the things that I have seen often as people coordinate, and the way Lisa described it and the way Kelly was describing it, is as I mentioned earlier, your coordination efforts tend to clear some of the fuzziness. So now you actually have a real picture. You're not guessing anymore. So when you coordinate things and you have all of this data in front of you about what's actually happening, you have this picture of the way that the system operates and how people are struggling to get access to different supports. Coordinating your system allows you to see those gaps. It allows you to see what's missing and to see what's working and what isn't working. And I've literally seen communities that as they, bring more and more partners to the table, and they actually start describing and talking about and clearing that fuzziness of this picture of their community, trying to serve people who are experiencing homelessness, it starts to turn light bulbs on for people. And there's people who maybe had different resources that they thought were not applicable in this situation, that all of a sudden they realize that, maybe these resources are better served in this coordinated system. Because as we coordinate and as we work together to streamline our processes, these individuals are going to get better access to the right supports and the right services at the right time for them. And they're going to be matched more closely to their particular needs. And what we know from the data and the research as well is that the better the match, whether it's a service or whether it's a housing unit or whatever that resource is, the better the match, the longer and the more likely it's going to be a successful transaction. And so what I see is that when we put all that information together and we actually sit down and we look at the reality of what our system is, it actually starts to open doors that didn't exist before. And people come to the table that weren't at the table before, and they have resources that we didn't know even existed in our community. And I can't tell you the number of times I've been in meetings in communities where there's hundreds of people there and they're talking about what exists. And initially you hear people say things like, oh, we know all the programs in our community, and we know everything that everybody does, and we know all the people who are experiencing homelessness. And inevitably, as the meeting goes on and more people start to talk, there's people that are shocked because they did not know somebody that was there. And they did not realize that that service or support was available. And so as you continue to work together, those things kind of come out of the woodwork, and you start to realize that you might have a little bit more than you thought you did. And you add one new thing into the system, and who knows what other doors that opens up for you. So I'm not seeing anybody who has any questions or comments. You know, please don't hesitate. This is an opportunity to share. Looks like there's something in the chat here that might be, it says, please share this anonymously. So I will. Our overwhelmed mental health system often discharges patients to homelessness before they're ready to care for themselves, even in the best situations. And homelessness is the opposite of the best. They claim correctly, by the way, that there are no spots available in the needed supportive housing. However, there are often options available, like family, that don't get consulted. The problem goes back to a lack of housing, but equally to the silos that exist. So this is a great point, I think, because the idea of silos, and oftentimes we think that we are coordinated, but sometimes we still are working in a silo. And I see this a lot too, where individual programs that are in a community feel like, well, because I know what resources exist in the community, I know what options are available, and we have relationships with them, that we are coordinated. But I don't think that's the type of coordination we're talking about. And so these programs are often working really, really hard to do their work. They want to support their clients very badly. But what they're missing out on by not allowing themselves to be sort of part of this whole coordination of services is, it's like I look at it like a pulley system, right? If you've ever worked with a pulley system and a rope, the more pulleys you add to that rope, the easier it is to lift whatever heavy load there is. So each organization could be looked at like adding another pulley to this rope system, so that this heavy lifting of the challenges of housing and supporting all of these individuals that are homeless, it actually can become easier, because you find yourselves, you know, working together to support the process, and that they're not just your clients anymore. They're now the communities or the system's clients, and you're all working for the same purpose, to support those of the highest need first, and then to continue to work together to completely end homelessness in your community. And so I think what this also highlights is that sort of what Kelly was referring to earlier, is that there are lots of other programs in your system that can play a role in your coordinated access process, like mental health systems. They are overwhelmed as well. And so I think that you know, accepting that even though we are a program in and of ourselves, and we have a lot of work to do, we can't do it on our own. And I think Kelly mentioned that earlier as well, that you're never going to be able to end homelessness for all of your clients or the community all by yourself. So it's essential that we build in the processes of working together, as opposed to working in silos. There's another individual who's here with us now. Her name is Kate Kimball, sorry. She is from Fort McMurray, and I'm just I talked to her earlier, and she was willing to come on and chat a little bit about this. So Kate, are you there?
I am. Can you hear me?
I can. It's great to have you. Thanks for jumping out of another meeting for us.
Yeah, no problem. Anytime.
So we've been talking a lot, Kate, about, and we talked with Kelly Gauze earlier, and Lisa Bell from Built for Zero and here at the Canadian Alliance has chatted a little bit. We're talking about barriers to the development and implementation of coordinated access, by name lists, that whole process. And we've mentioned several different barriers that are there. And Kelly talked quite a bit about some of the things that she feels are important in overcoming those barriers. I'm curious to know if you have any thoughts about any particular or specific barriers that Fort McMurray has faced as you've gone through this process, that sort of standout ones that you think were maybe more challenging, and what was helpful in addressing those barriers, or are they barriers that are still a challenge and you're still working at them?
So we have a couple of both. One of the biggest ones in our community in Fort McMurray is we've been offering housing first and programs of the like for years now, 10, 15 years at this point. Prior to a by name list coordinated access system set up, we had what we called centralized intake. It was one agency that worked with the housing bodies to refer individuals to them for housing. And it seemed like it was working really well because prior to that, the agencies who worked with housing first clients would find their own clients. So there was double dipping, duplication of services, stuff like that. So when centralized intake stepped in, it was really great. There was a little bit of pushback from the agencies, but the one piece that we found we were really missing by just having them as the centralized intake and not a full coordinated access system is they were only working with the agencies who provided housing. They weren't necessarily tapped into Alberta Health Services. They weren't working with community policing. They weren't working with all these other bodies, similar to what you just mentioned about that siloed look. And then the other thing was they were referring based off of client history and just using the SPDATs. They weren't really looking at it as a whole. So what we did in 2017, we started working on creating a by name list and actually assessing using VI SPDATs opposed to the full SPDAT. And we actually pulled in, at the time, there was 6 different agencies, but now I think we have like 14 or 15 agencies who are all considered access points. So instead of having the individuals who want to be assessed for housing go directly to centralized intake, now they can be assessed at 15 different points in town. So what that created for us was we were sort of funneling people through, which is what you want to do, but there was such a stopgap with people actually able to get into centralized intake because of timing, transportation, because they only work like an 8 to 4 kind of schedule. So now people can actually be assessed at all of the shelters in town. They can be assessed at the hospital. They're assessed when they're discharged from the hospital. They can be assessed with AHS Street Connect. So there's so many different bodies in town that actually are able to support with assessing individuals to put them on the by name list, whereas before it was just one agency. And what that's done is it's actually provided a better picture of the individual, because the majority of the time, if you're working with John, for instance, if AHS knows John, they know whether or not John's answering the questions to the best of his ability at that time, or he's just answering the questions based off of how he thinks he should answer the question. So you actually have a relationship with the person that you're answering the questions with. So you feel a little bit more comfortable with them, and you know them a little bit better. So you can dig a little bit deeper if you have to. So that's actually given us the ability to really push people through our system and prioritize them based off of needs, opposed to just history and biases of certain agencies. So that's been the biggest one for us in regards to challenges and barriers, because it's been like the whole process itself has been a little challenging, but figuring out all the kinks to do that, that's been it's been the hardest part, but definitely the most rewarding and the biggest success that we have for sure. And then the other one would be getting AHS on board, because as we all know, sometimes having the health body in your region is quite difficult. But knowing that our team actually, I think there's a team of 12 Alberta Health Services Street Connect members that go out and work with the community. They're all trained on completing the SPDATs or the VI SPDATs and assessments. So we have them and Alberta Health Services discharge team actually as VI access points. So getting them on board took a while.
So does that mean then, Kate, that even those folks from Alberta Health Services are able to, like, they're connected to the same database then?
Yep. Yeah. So all of our access point staff, they have access to the by name list. It's sent out weekly, and we actually have monthly meetings to discuss the people at the top of the list, and AHS sits at that table locally. So the coordinators within the Street Connect team and the discharge team and the psychiatry ward.
Yeah. So the use of the database helps to prevent that earlier challenge of sort of duplication that you talked about.
Yeah, well, the discharge plan from the hospital a lot of the times is street in Fort McMurray, unfortunately. But what it gives us is the ability for them to call and say, hey, I know this person's on the BNL. Where are they at on the list? Like, if I discharge them tonight, how much longer are they going to be on the street? And more often than not, we can't give a time frame and say, like, oh, they're going to be housed in 4 days. But at least we could say they're currently working with a caseworker. They'll be housed or warm transferred within the next week. So it gives them a bit of a range, and they have a relationship, which makes it a little bit easier for case conferencing. Yeah.
So if I can ask you another quick question, then.
Go ahead.
You said like 15, I think was the number you used, of organizations or places that people can sort of get entered into the by name list and be assessed. Are those any of those places the organizations that would end up potentially getting the referral to support these individuals?
No.
So is that intentional?
Yes. So we have, they would be in a sense. So centralized intake, for instance, Wood Buffalo Wellness, they have the ability to assess because they're the centralized intake body who organizes the by name list, but they also do run a housing program. Disconnected in staffing though. So one staff at centralized intake has no say over how someone is housed or when they're housed within the housing program. That would be the only one really that's connected. None of the housing staff are trained in completing the assessments. So there's no connection. They might have the same supervisor, but they wouldn't have the same programs. And yes, intentional.
Can I ask the reason that was intentional that way? So
historically in Fort McMurray, they used to be able to assess and take on their own clients. There has been quite a few years of conflict in picking and choosing particular people, knowing that some people are harder to work with. And we did it that way specifically because we didn't want anyone to say, oh, I've worked with that person before. I don't want to do it again. Or I know that this person has problems that we can't support. We don't have the capacity. So we've done it that way specifically. So they don't know what they're getting when they get it. We're really adamant on making sure that you're assessing based on where the person is now. And if you have a history with an individual, that makes it very challenging. We're all human at the end of the day, right? And if you have thoughts and pre-decided ideas in your head, it's really hard to get past some of those.
Yeah, interesting. That I just asked you those questions because I think, again, that's a common piece that comes up when you talk about, access points and how you organize and structure them. And I know that it seems to be the obvious thing to have, kind of your existing housing first programs or whatever it is, take on that role. But in some cases, it maybe isn't the best option. So I appreciate that. And thank you so much for that information. So is there anything else that you, Lisa, I know you're still hanging out. Is there anything else that you guys would say to just sort of finalize your thoughts or comments about dealing with barriers and the best way to deal with barriers when it comes to implementing coordinated access?
I will go since I just finished. The one thing for us is, as hard as it is, look at barriers like silver linings. We've learned so much through the challenges that we've come through, and we've used them to our advantage. For anyone familiar with Fort McMurray, we've had floods, we've had fires, we all had COVID, but we have truly used that as a silver lining and use it to our advantage, which sounds terrible, but like with the flood, for example, we use the by name list as a way of tracking individuals who went missing during the flood. So we really, and same with COVID, we've really used those barriers and challenges as a way of recreating systems that actually work for them. So that'll be the biggest thing for me.
Nice. Thank you. Thank you. Lisa, any final thoughts from you?
I think I would just echo what Kate said. Yeah, you use barriers as opportunities wherever possible. And also this work is hard. By name list, coordinated access is hard. Ending homelessness is hard. So if it was easy sailing, if it was smooth sailing all the way through, then you might not be actually working through things that you need to work through to build a solid foundation and a true collaborative space. So I think, expect it to be hard, and that's okay. It just gives you that much more insight and opportunity to improve. And then you know that the work that you're doing is making an impact if it's starting conversations, if it's kind of bringing up some things that you didn't know before.
Yeah. Yeah. Thank you. It makes me think about how, we don't ever strengthen anything without resistance. And so, I think we kind of have to have some barriers to deal with and work through so that we can become stronger and better. And so, like you said, Lisa, if we didn't have any of these challenges, then the problems would all be solved anyway. So barriers are an important piece of our growth. And so yeah, think of them as silver linings or as opportunities, as was mentioned. And I just want to say that regardless of the barriers, I know that people can do it. I know that you can. Anybody who's on the call, I know that you can be able to work through the different barriers that you have and come up with some level of solution that will assist you and help to streamline the work that you're doing. So I thank you everybody for being here. What you see on the screen is the upcoming BNLCA webinar list for the next little while. So you can go to our website at training.cah.ca and register for any of those. We're always happy to have people join us for those. Otherwise, thank you so much for your time today, and hope you guys enjoy the rest of your week. Thanks, Kate. Thanks, Lisa. Thanks again to Kelly for joining us earlier, and thank all of you for the hard work and the tremendous things that you have accomplished in this effort to end homelessness in Canada. Thanks a lot, everybody. Take care and have a great day.